Okay, so jumping right into this deep dive, you guys have sent us in a ton of material about American healthcare articles, reports, studies, the whole works. It's something we all deal with, right? And let's be honest, it can feel more confusing than it should.
Yeah, for sure. I mean, most people probably have more questions than answers when it comes to healthcare.
So that's exactly what we're going to do today, cut through the clutter and get to the heart of what's going on. We want to make sure you can walk away feeling like you really get it, without having to wade through a mountain of research. Think of this as your crash course in everything American healthcare.
Exactly. We're going deep on this one. We're talking about how this whole system works. The public side, the private side, employers, government programs like Medicare and Medicaid, and of course the big one, all those folks who are still left out entirely.
Right. Because it's definitely not a one-size-fits-all situation, is it?
Nope, not at all.
Okay, so before we jump into the nitty-gritty, let's do a quick history lesson. How we get healthcare in America today, well, it's got a backstory. We're talking about roots that go way back early 20th century when employer-based insurance started gaining traction. And then after World War II, boom, that model just exploded, becoming the way most Americans got access to doctors and hospitals. But even back then, it wasn't for everyone, and that set the stage for a lot of the issues we grapple with today.
Yeah, and it's fascinating how those early decisions kind of shaped everything. Employer-sponsored insurance was great for a lot of folks, but right off the bat, it wasn't universal. A lot of people were excluded. Think agricultural workers, service industry folks, a lot of essential jobs, really. And as the cost of healthcare started going up and up, this link between your job and your health insurance, well, it started to leave a lot of people in a really vulnerable spot, especially those stuck in unstable work or without any job at all.
Right, and we can't talk about this evolution without talking about the ACA, the Affordable Care Act, back in 2010.
Mm,
That was a huge attempt to get more people covered, right?
yeah.
And it really stirred up a lot of debate about what the government's role in healthcare should be, how much individual responsibility matters, and this whole idea of collective support.
Absolutely. And it really goes to show that American healthcare isn't just about laws and insurance cards and all that. It's a reflection of our whole history, our economy, our political beliefs. It's a messy system for sure, and that explains why we see so many issues that just won't go away, rising costs, and major differences in who gets good quality care.
So let's get into those issues. Based on all the research you sent us, what are the biggest problems we need to be paying attention to right now?
Well, one of the most glaring issues is just how unequal things are. One of your sources said there are still something like 30 million Americans without any insurance at all. Yeah, that's a big chunk of the population who can't just go see a doctor when they need to, and we all know that can lead to some really serious problems, health-wise and financially.
That's a huge number of people. And, it's got to be connected to how expensive healthcare is, right? Because even if you do have insurance, just affording it can be a whole other struggle.
You got it. And the data from the Kaiser Family Foundation that you shared really backs that up. The average yearly premium for a family plan through an employer is almost $22,000. That's a massive burden for a lot of families.
Sure, right, yeah.
And that's not even counting all the extra expenses that come up, deductibles, copays, all those things. So when people are feeling that kind of financial pressure, they put off going to the doctor, maybe skip filling a prescription, and in the long run, that can be really bad for their health. Some of the studies you sent in even found that it's linked to lower overall life satisfaction.
That's really interesting. And, it's not just about the money itself, is it? It's about whether people are actually happy with the care they're getting when they do manage to see a doctor.
Right, exactly. And some of those surveys from the American Psychological Association that you sent over show a pretty high level of dissatisfaction. People feel like they're waiting forever to get an appointment, like they're not getting enough attention from their doctor, and the whole insurance process just feels like a maze.
Yeah, like a never-ending maze.
Exactly. And so when someone has a bad experience, they're less likely to go back, even if they need to. And that can create bigger problems for public health in general.
It's like the system is working against you, not for you. And then on top of all that, you've got racial and economic disparities.
Oh, absolutely. A huge problem. Minority communities, they face more roadblocks to getting care, and the outcomes are worse too. The CDC data you shared about higher rates of chronic diseases among Black and Hispanic populations really underlines that. And it's not just about individual choices, it's about the systemic issues and inequalities baked right into the system.
Right. And we can't talk about the system without talking about insurance companies, right? They're at the center of so much of it.
Yeah, they're the middlemen, and it's a tricky role. On the one hand, they manage all the financial risk that comes with healthcare, which we kind of need in this setup. But they're also businesses, and they want to make money. And that's where things get complicated.
So how does that profit motive play out in our everyday experiences with healthcare?
Well, it shows up in a few ways. They negotiate prices with doctors and hospitals, which is how we end up with this crazy complicated billing system, right? You get a bill and you have no idea what anything means.
Yeah, it's like a foreign language.
Exactly. And those negotiations can also mean patients end up having to pay a lot out of pocket, either because their plan doesn't cover certain things or because of surprise charges that pop up out of nowhere. And then there are things like prior authorization, where your doctor needs to get permission from the insurance company before they can do certain tests or treatments.
Ugh, yes, I've been through that. So frustrating.
Right. It can cause delays in getting the care you need, and it just creates so much extra work for doctors and nurses. And if we zoom out to look at the big picture, that focus on profit, it can mean insurance companies don't invest enough in preventative services. Think about things like routine checkups, screenings. Those are all about catching things early and preventing bigger problems down the road, right? But if an insurance company is mostly worried about costs in the short term, they might not want to put money into that. It can lead to worse outcomes and, ironically, end up costing more in the long run.
It's almost like shooting yourself in the foot.
Yeah, kind of. And then there's the whole thing about narrow networks. That's when you're limited to seeing certain doctors and going to certain hospitals. It can really impact the kind of care people get, especially if their trusted doctor or the best specialist for their condition isn't included in their network.
Okay, so we've talked about the problems with access, and now we've got this problem of cost, too. Healthcare costs just keep going up and up. What are the biggest things pushing them higher?
The sources you sent in point to a few key things.
Yeah.
All the administrative stuff, drug prices, and then the constant advances in medical technology.
Okay, let's break that down. Administrative costs, what makes them so expensive?
It really comes down to how complicated our system is. You've got tons of different insurance plans, each with its own rules and regulations and paperwork. It's a nightmare for everyone, insurance companies and doctors, too. They're spending a lot of time and resources just trying to keep up with everything, dealing with billing and making sure they're following all the rules. All that adds to the overall cost, but it doesn't actually make anyone healthier, does it?
Not really, no.
Yeah.
And then there's the issue of prescription drug costs, which seems to be a big part of the conversation whenever we talk about healthcare.
Yeah, it's a big deal. The U.S. has some of the highest drug prices anywhere in the world. It's a mix of things, no government price controls on a lot of meds, massive marketing budgets by drug companies, and then, of course, the money that goes into researching and developing new treatments. Whatever the reason, it means a lot of people are paying through the nose for the medicines they need, and some people end up having to choose between their health and their wallet.
Yeah, it's a tough choice for sure. And what about technology? Feels like that can be a blessing and a curse.
Absolutely. All the new technology in medicine is amazing. Better diagnoses, more effective treatments, people living longer, healthier lives. But developing all that new tech takes a lot of money, and guess who ends up paying for it? It gets passed on to us through higher insurance premiums and bigger medical bills. So yeah, we're getting better care, but it's getting harder and harder to afford it. And that raises some serious questions about who actually gets to benefit from all this progress.
It all comes back to those fundamental questions. Who has access to healthcare, and how much are they paying for it? And we've already talked about how access isn't equal for everyone.
You're absolutely right. When it comes to healthcare in the U.S., where you live, your race, your income level, it all matters. And your sources lay out just how big those gaps are.
So let's unpack that a little bit. What are some of the specific challenges that people of color face when it comes to getting care?
Well, there are a lot of systemic issues at play, including bias, sometimes even unconscious bias. Studies have shown that minority patients are sometimes treated differently. Maybe they don't get the same level of care as a white patient, even if they have the same condition. And you can't ignore the history, right? Discrimination in healthcare is real, and it's created a lot of distrust in some communities. It can make people hesitant to seek help, even when they need it.
That makes a lot of sense. And then you've got socioeconomic status, which creates its own set of barriers, right?
Absolutely. People with lower incomes face a lot of obstacles. The obvious one is not having insurance at all, but even if you have it, there's the cost of copays and deductibles and all those out-of-pocket expenses. Sometimes just getting to a doctor's appointment is a challenge if you can't afford transportation or if you live in an area where there just aren't enough clinics or doctors. All that means people often delay getting preventative care or the treatment they need, and it ends up hurting their health in the long run.
It's this interconnected web of problems, really. And then on top of everything else, where you live also matters, right?
Exactly. People in rural areas have fewer options. They might not have a hospital nearby or enough specialists, so getting timely care, especially for more complex conditions, can be really tough. But it's not just a rural problem. Even in cities, you see disparities based on what neighborhood you live in, especially in areas with high poverty and crime. People might not have access to healthy food, safe places to exercise, or good quality healthcare facilities.
So we've got all these deeply rooted problems, and then we look to the government to fix them. But that seems to come with its own set of roadblocks, doesn't it?
Yeah, the political side of healthcare is, well, it's a mess. You've got so much division between the two parties that it's almost impossible to agree on anything. It leads to gridlock, nothing gets done, and policies can change dramatically every time a new party takes power, which makes it hard to build a system that people can actually rely on.
It's like you're always starting from scratch.
Hmm.
And then you factor in the influence of all those powerful groups who want to say in how healthcare works.
Oh, yeah, the lobbyists, the drug companies, the insurance companies, they all have a seat at the table, and they're often pushing for things that benefit their bottom line, not necessarily what's best for patients. It's
Hmm.
hard to pass reforms that actually address the root causes of high costs and limited access when you've got all these competing interests.
It's like a tug of war, and the patients are in the middle. And then we haven't even mentioned the whole mix of state and federal regulations.
Right, another layer of complexity. Healthcare policies can change drastically depending on what state you're in. Different rules about insurance coverage, about Medicaid expansion. It creates a patchwork system where your access to quality care can depend entirely on your zip code. It makes it tough to find solutions that work across the board.
It sounds like a real uphill battle. But it's important to remember that people are trying to find solutions, right? What kind of innovative ideas are out there? What are people proposing to fix this?
Well, there are a lot of ideas flicking around. One big one is universal healthcare coverage. The idea is to make sure everyone has access to basic healthcare services, no matter what.
And how would that work?
It would involve expanding coverage to every single resident so no one's left out. And it's not just about being nice, it's about taking care of people and potentially saving money in the long run. Other countries have done it, and it seems to be working. And another key idea is putting more emphasis on preventative care.
That makes sense, right? Catching things early or even preventing them altogether has got to be cheaper than dealing with big problems down the road.
Absolutely. And there's a lot of talk about making healthcare prices more transparent. Right now, it's a black box. No one knows what anything costs until they get the bill. But if doctors and hospitals had to be upfront about their prices, and if quality ratings were easier to find, patients could make more informed choices, right? It could also create more competition, which might bring prices down and improve the quality of care. And we can't forget about telehealth, which is becoming more and more important, especially for folks in rural or underserved areas. Being able to see a doctor remotely could make a big difference in access.
It's kind of like bringing the doctor's office to the patient, right?
Yeah, exactly. And there's a growing understanding that we need to address all the social factors that impact health. So we're talking about things like working with doctors and community groups to improve health education, make healthy food more available, and connect people with resources to help them live healthier lives.
It's about more than just going to the doctor. It's about creating a healthier environment in general. You mentioned preventative care earlier, and I feel like we should spend a little more time on that because it seems like such a crucial part of the solution. So we hear the term all the time, but why is it so important?
Preventative care is about staying healthy, not just treating illness. It's about things like vaccines, regular checkups, screenings, getting advice on how to live a healthier lifestyle. And it's important for a couple of big reasons. First, it can help people live longer, healthier lives, right? Second, it can save the healthcare system a ton of money in the long run.
So how does it save money?
Think about it this way. A lot of what we spend on healthcare goes towards treating chronic conditions like heart disease, diabetes, stuff like that. And a lot of those conditions are preventable, either through lifestyle changes or by catching them early. If you invest in preventative care, you can reduce the severity of those conditions, sometimes even prevent them altogether.
Give me an example.
Okay, so let's say someone gets regular screenings for diabetes. If they're diagnosed early, they can manage it through diet, exercise, medication, and potentially avoid really serious, expensive complications down the road, like needing dialysis or having a stroke.
So it's not just about saving money. It's about better health outcomes, too.
Exactly, you get it. And it's not just about the individual or the healthcare system either. When more people are healthy, it means less strain on the whole community. Healthcare resources can be used more effectively, and everyone benefits.
Makes sense. So we've covered a lot of ground here. The history of American healthcare, the challenges it's facing, the role of insurance, and some of the ideas for how to make things better.
Yeah, we've gone deep. And it's important to remember that understanding how all this works is the first step. Once you get a handle on what's driving those high costs, what's keeping people from getting care, and why some groups are treated differently, then you can start talking about real, lasting
And
solutions.
that means everyone needs to be involved, right?
Absolutely. It's a team effort. We're talking about doctors, patients, policymakers, everyone. And it's important because this stuff affects all of us. We're talking about people's health, their families' financial security, the well-being of our communities, and even the economy. If we don't address these problems, things are going to get worse, and it could have some serious ripple effects.
So to wrap things up, I want to leave you with something to think about. We've talked about how complicated and messed up American healthcare is, but we've also talked about some potential solutions. So here's the question. If you could pick one guiding principle, one big idea to shape the future of healthcare, what would it be?
I like that. Something to ponder.
Yeah, food for thought. That's what the deep dive is all about.
Exactly. Thanks for joining us.
And thanks for sending in all your research. We'll be back next week with a new deep dive into